For those of you who this might be your first WASHAA meeting, you might not know that our organization is the first and really only national, a statewide not-for-profit organization focused on health advocacy. So we in Washington State are really fortunate to have a whole awesome community that's been working for a very long time on health advocacy efforts. So I'd like to kind of orient ourselves back to what is health advocacy. And Sean D'Amelio very astutely pointed out that in Dr. Hanscom's talk, he put up a whole list of providers and allied industries and said, good luck getting all of these people in one room at one time, right? And if you're a health advocate, you know what that means. But that is exactly the point of health advocacy, is threading all of the specialties together to get everyone on the same page. And through my years working with Beth Droppert, longtime nurse pioneer in this industry, she and so many of you have taught me so much about how that works. We're very, very lucky to have a whole community of people to do that. Is anybody else warm? All of a sudden I'm just like, woo, okay. Maybe we can open that up. Okay, so what is health advocacy? Health advocacy is the act of helping a person by understanding them, supporting them, and asserting their choices to obtain the health care that they want and deserve. And so that's just kind of focusing us back into the fact that all of these things need to be present. Person needs to be understood, supported, but also their choices need to be asserted, because even if you have understanding and even if their choices are clear, sometimes those choices don't happen, and you all know that. So I want to cast back to 7 years ago, the birth of our organization and the health advocacy movement just getting started. And I put up Yosemite Sam because I think I put that up. Where is Iodolka? I don't know if she's still here, but she was our executive director at the time. And we had Yosemite Sam up because it was the Wild West. There was no consumer awareness about health advocacy. There were very few, less than 100 advocates at that time nationally. There was a lack of mentors or success models. There were no nationally embraced practice standards and no nationally independent credential, which we knew even back then was really a key to this profession taking off. So it was an exciting time because we knew that there was definitely a need, but those things had yet to happen. So flash forward today in 2019, and I have a work in progress icon there. And what is so cool is there is some consumer awareness, and there are some surveys out there that are going to come out showing that consumers are mildly aware of health advocacy and patient advocacy. But there's a growing number of advocates, and we're going to talk a little bit about some of the organizations that are supporting advocates. There are mentors that are working, and there are experimental models being tested throughout the country, some of which are actually getting paid for and some of which are actually kind of working. I mean, it's still early times, but we know our colleagues, I believe in Chicago and Wisconsin, are embedded in the hospital, testing out whether independent advocacy is helpful in improving outcomes, which is, we really need the research. There are national practice standards in place, and some of the national organizations are going after that. And if you would like to know more about practice standards, raise your hand, Beth. Beth would be the person to, Beth Droppert would be the person to talk to, and she was very instrumental in pioneering that area. There is also a nationally recognized independent credential called the Board board certified patient advocate. I think that there's a typo there, sorry. Through the PACB board. How many people in this room have their credential? So we have a couple people in this room and me talking about that. So it's really exciting. We're still on the early time of this profession, but it is growing. So one of the ways that it is growing is through this consumer awareness tide. And I don't know how many people in the room were able to see To Err is Human. How many people saw that this year? Okay, a handful. If you have not seen that, there are screenings all over the country. There's a public website. And To Err is Human is a documentary that was done 20 years after To Err is Human study was done, where you all probably have heard the statistic that preventable medical errors in the hospital are the third leading cause of death in our country. And the point of that statistic was to show that we need to measure what we want to change in healthcare so that we can improve it. And To Err is Human is a documentary that basically talks to people in the healthcare industry and clinicians about what it's really like and how challenging it is to practice and to help patients, and some areas where we need to improve. The reason why this is so important for health advocacy is all about getting patients involved. It's not just the medical system who takes responsibility for safety. We all should be involved in best safety. So if you've been here before, you are familiar with some of the national organizations, and I'm going to just review them quickly and how they have grown in the last little bit. So the first national organization is the Alliance of Professional Health Advocates. This is basically a professional marketing organization that supports working advocates. It's run by Trish Torrey out of now Florida, and it has 600 members nationally. And she tells us that the big change between last year and this year is there are 280 advocates in her directory who are actively practicing, up from 200. So it's a pretty big jump of 80 in 1 year. Still pretty small profession, right? 600 nationally. She holds boot camps and workshops and has now an online CEU and workshop a site called Practice Up. And so that's a really good place to earn your CEUs if you're a board certified patient advocate. The National Association of Health Advocates, NAHAC, National Association of Healthcare Advocacy, they changed their name, is a national organization, national professional organization. And what they have done in the last year is they've really increased their CEs for nurses and board certified advocates through their webinars for members and non-members, in case you're interested in looking at that. Their public education offerings, they've been broadening out their webinars. They've revised their code of ethics and best practices. And they've completed a directory of advocacy education programs in the United States. They also launched their first regional group in Massachusetts. So that organization has been growing as well. And the Patient Advocate Certification Board, and you might be curious as to what that is. It's a national group. It's not certified by anyone. It's just a national group. So you need to know that, of different people throughout the country. And they have come together to put together this test, this certification test. And I'm going to share with you some of their slides that were just released and some of the information that they have. And if you want any more information, you can go online or contact Danielle Marshall, and her information is right up there. Really exciting that the first exam was March of 2018. And since that time, they have several other exams for which people have sat. And now, after 3 testing cycles, 488 people nationally have that certification. So it really has taken off, and I think that's a really great thing. Um, if you would like to know more information, there's a lot of information about this credential. Again, Beth would be a really good person to talk to about that, as well as who are the people who have been certified. Mary Anderson and April Box. Anybody else? Okay. So the strategic future of that credential is a universally recognized credential for patient and health advocates that champions patient well-being. And they're going to be looking at eligibility requirements after the 4th exam cycle and potentially implementing some additional requirements. So, for instance, there wasn't any requirement on education or experience or anything else, and there may be going forward. So next group I'm going to talk about is the Greater National Advocates. This is a group that was founded out of Chicago, and they have several subdirectories like the Greater West Advocates. I think they have the Greater Midwest Advocates. This was formed by Brad Schwartz, an attorney out of Chicago who himself was experienced extreme medical harm, lost all of his limbs to medical error. And he felt that he needed to urgently do something. So his contribution to this field is to create an easy advocate directory, easy to find, and anyone who is a practicing advocate should consider joining this directory. It's free to join, and the point is to be easily connected to patients. You do have to have insurance liability in order to join, and you will be hearing more about this directory and the awareness campaign that Brad's organization will be putting forward at the beginning of this year. And I know that he did also conduct some national research, testing consumer awareness about health and patient advocacy. So I'm hopeful that we'll get to see. I haven't seen it yet. I've been bugging him about it, but I'm hopeful that he'll be releasing that data. But there's a spoiler alert. He said that basically consumer awareness is not very high still. So this year, there was also a new effort called the International Conference on Patient Advocacy, ICOPA, and actually Beth was our WASHAA representative there. And this was a really important effort because it was the first national conference to bring all health advocacy organizations throughout the country together on one stage in one place. There were 177 advocates who were there. They pretty much sold out, which was great. So we will likely be seeing more of this annual conference if you are an advocate and interested in this. And again, if you are interested in learning more about what happened specifically at this conference, please go see Beth. Drop her. Beth has the answers. Okay. So WASHAA, just a little bit about who we are. We are dedicated to promoting health advocacy in Washington State and empowering patients. That's really our core of what we do every single day. And our vision is really to revolutionize how people see themselves, to go from patient, which is reactive, to a participant and partner in their healthcare. And we do this, we fulfill our mission and vision basically in 3 specific areas that I'm going to be talking about: awareness, skill building, and connection to resources. So public awareness, we do a bunch of presentations, which you may know about. And if you don't, please go on our website. I'm going to be talking about one specifically in a moment. Skill building this is still such a new area that we teach skills through workshops, majority of which are free to the public. And so if you know of organizations that could benefit from our workshops, please invite us. We also have a directory of advocates, and I don't know if you know, we run an inquiry program where people contact us searching for all kinds of health advocacy resources, connections to health advocates, and our organization, primarily Beth and some volunteers, field those calls. We also, with your help, put out these resource guides. This is the second year that we've done that. Thank you. Last year, our resource guide was on end of life resources, and this year, obviously, it's on pain resources. And so we're dedicated to, tackling one big topic a year. And if you have suggestions as to what next year's topic should be, please let us know in the follow-up survey that will be in your email when you get home tonight. So we've made good progress this year. One of the things that we just launched is a podcast series, and we were really lucky to have Dr. Hanscom be our kickoff interviewee. So please find that on our website. You're going to hear a lot of that, of what he has to say in the workshop today, but boy, he has a lot of content. So please subscribe to this podcast and let us know what you think about it. We also have professional initiatives that support this whole community of advocates. So we feature a quarterly networking session for professional advocates and others in the community. And our next one will be December the 6th. And it's on our website to sign up for that. And we also available to professional members only, because it's a closed small group. We do something called case review, where we go through a compelling case that is managed by a health advocate to see what went right, what went wrong, what are the typical things that health advocates do, and where are the challenges and successes and opportunities. That case review is going to be November 6th. I think the networking then is December 5th. I think I got that wrong. I think so. Check on our website. Should have put the dates up there. So we also do a lot of public education. So some of the talks that we give, ABCs of an effective doctor visit, taming the medicine cabinet, patient no more, and we also give safe and sound in the hospital. These are very easy, simple, accessible presentations that anyone can understand. And we're grateful to Tina and her group who had us come and speak at Baby Boomer Boot Camp. And so we love doing those presentations. And here's an opportunity for you, which is we're making some of our presentations available for you to give those. And I'd like to recognize Carrie Andrews, Mary Anderson, Maggie Pheasant, Tina Vanden Bosch, and Oscar Meza. Can you just raise your hands for those trainers? So thank you so much. These are folks that have gone through our Train the Trainer, and they're available to give the ABCs of a doctor visit presentation. So find them and ask them to come to your community. It's 100% of the people who go to that presentation find it useful. So it's just a no-brainer. I talked a little bit about our inquiry program. We've gotten a lot of phone calls this year, and the primary way that people connect with us is through the web or by phone. And 3/4 of our inquiries are from Washington State, but 1/4 are outside of the state. And we have a pretty good response rate, which is when somebody contacts us, we try to call them within a day. Sometimes their mailbox is full, so we can't reach them, but that's why our response rate is 88%. But there's no one else in the state that really does a program like this. So we cannot do this without your support. This is my little pitch for WASHAA and you joining. If you're a member, we are running a special, which we did last year as well. So there's a certain amount of money off your membership if you join between now and November 15th, and you can do that online. We have membership benefits that are listed online, and I just want to do a shout out to Sheila. Where's Sheila? in the back, who has been our wonderful intern, who has been working on membership for us. We're so grateful for all the good things that you've been doing. Please join our community, make a donation. We, run very slenderly on a very slim budget, but we have big plans. And so the more people and organizations that we have joining us, the more that we can do. So we can't do it without you. I also want to recognize Tracy Wise. Where's Tracy? Tracy, thank you. So Tracy is the artist who is featured on our wonderful WASHAA calendar. And if you join as a member, you will get one of these very lovely annual calendars will be mailed to you with our gratitude. So thank you, Tracy, for lending your beautiful artwork to our efforts. So a quick shout out to our wonderful board and staff. Can I have our board and staff please rise and just be recognized? This does not, all of this stuff just doesn't happen on its own. It takes all of us doing all of our jobs. And I feel very, very blessed to have just the most wonderful board and staff. Even Ashley, who just had a baby, came because she wanted to be here today. So I don't know if you saw her back there, but she's a cute little baby girl. So finally, but last but not least, I would like to thank our sponsors. And we're really just so grateful to have a wonderful community of sponsors. And we really can't do this work without you. So please give a round of thanks to our sponsors, Acadia Health and Brain Cancer, ERA Living, Prince Financial Services, A Sacred Passing, CHCS, Guardian Nurses, Pinnacle Care, Elder Grow, Final Roadmap, With a Little Help, and We Trust. Thank you so much.